It's the first time in history a public health emergency was declared as a major disaster under the Stafford Act. It's also the first time there's been a nationwide declared event. It's also very unique in its incident period in that, you know, most emergencies or natural disasters have a finite incident period and a relatively quick shift to recovery. The COVID-19 event is drastically different from that as we continue to perform work related to the open incident period and period of performance. And it's really impacted the operations of all the applicants on the phone in unprecedented ways. So I want to acknowledge how unique this event has been, and for that reason, it continues to be a very fluid and dynamic landscape as we continue to recover and respond to the COVID-19 pandemic. Today, we're very grateful for the partnership we have with FEMA Region 2. As you may know, FEMA is headquartered in Washington, D.C. and is organized nationwide across 10 regions. FEMA Region 2 includes New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands. Throughout this event, we've worked closely with FEMA Region 2 to provide the most up-to-date and accurate guidance to our applicants under this fluid and dynamic event, as I've discussed. I wanted to acknowledge the work of all of our applicants on the phone who have continued to work and protect the public health and safety of our residents in the state, and have done so throughout the last 6 months, from a time when New York State was the epicenter of the COVID-19 pandemic, through New York on pause, and now through our reopening efforts where our COVID-19 statewide infection rate is below 1%. I want to thank our state, tribal, local, and private nonprofit partners for the work you're doing and the work you did to bend that curve. Today we're hosting this presentation to share information regarding FEMA's new interim public assistance policy related to eligibility of certain work, supplies, and materials under DR-4480, or the COVID-19 Major Disaster Declaration. As you know, 2 weeks ago, FEMA headquarters issued a disaster-specific interim policy regarding eligibility for public assistance funding under this event. And this new policy restricts eligibility for the reimbursement for certain items of work, supplies, and materials under the COVID-19 disaster beginning September 15th. For work completed between January 20th, 2020 and September 15th, 2020, FEMA headquarters maintains that eligibility of emergency measures necessary to protect public health and safety are subject to initial guidance issued specifically for COVID-19 as well as existing policy. We've asked FEMA Region 2 to answer your questions on this new policy today, and they've kindly agreed to do so. Division of Homeland Security and Emergency Services Public Assistance Chief Andrew Martin will walk you through a short presentation today, followed by questions we will pose to FEMA Region 2, and then we will take questions from applicants on the line for FEMA Region 2 to respond to. Please use the chat feature in your WebEx to submit your questions, and we'll be asking those questions on your behalf. We hope to get to as many of them as possible. For full awareness, the presentation and the Q&A will be recorded today, but participants other than speakers will not be recorded. We'll post the slide deck and the recording of the presentation on the Dishes Recovery website after this presentation. Quickly, I'm joined today by Rana Gonzalez, who is the Deputy Director of Disaster Recovery Programs for the state, Susan Munch, who's the Recovery Finance Director, Joe Colarafi and Joe Stinson, who are our Deputy Chiefs in the Public Assistance section for recovery programs. We are also joined by Molly Avancho from FEMA Region 2, who's the Appeals and Audit Section Chief, Daniel Hiley, FEMA Region 2 Deputy Infrastructure Branch Director for DR-4480, which is the COVID disaster, and Trevor Carl, who is the Public Assistance Group Supervisor for DR-4480. So thank you to everyone for your time today, and I'll pass it on to Andrew Martin.
Thank you, Ann. And thank you all for your time again today. All right, so again, on September 1st, a couple weeks ago, FEMA headquarters published interim FEMA policy FP 104-00919, coronavirus COVID-19 pandemic, work eligible for public assistance. We have placed that on the Dishes Recovery website. It went into effect this past Tuesday, September 15th. and it is not a retroactive policy. So this interim policy applies to work performed on or after the effective date of September 15th, 2020. Work completed prior to September 15th is supported by prior interpretation of policy, regardless of project submittal date. If a project contains work performed in both periods, the applicant must document those costs separately. FEMA's interim policy that went into effect on the 15th restricts eligibility of the below previously eligible work and materials and supplies. Disinfection. According to the new policy, only eligible for reimbursement through public assistance in medical care, medical sheltering, and other eligible emergency services settings. Personal protective equipment. Only eligible for reimbursement through public assistance when necessary to conduct eligible emergency work, including PPE for healthcare workers and first responders. The impacts of FEMA's policy change. FEMA's initial policy allowed for broad reimbursement of cleaning and disinfecting and PPE for all applicants, all eligible applicants. This policy change will impact nearly all applicants. Schools, houses of worship, transit authorities, and non-medical private nonprofits will be particularly impacted, as most DR-4480 projects for these applicants are solely for PPE and disinfection costs. State, local, and tribal governmental entities will also be impacted. So the list of guidance and fact sheets on this slide remain in effect. These fact sheets are available on the FEMA and DISH's websites. You can see those all here. And again, these slides will be posted on our website early next week. So the new policy that went into effect on September 15th superseded, and there was a fact sheet put out by FEMA in March of 2020 called the Coronavirus Pandemic Eligible Emergency Protective Measures Fact Sheet. The guidance that went into effect on the 15th superseded that fact sheet and is no longer in effect. According to the new policy, only work associated with the performance of emergency protective measures specifically listed in the policy document, FP 104-00919, is eligible for public assistance reimbursement in COVID-19 declared events, specifically medical care, in accordance with COVID-19 specific policy or subsequent updates, purchase and distribution of food in accordance with COVID-19 specific policy or subsequent updates, non-congregate medical sheltering, the operation of emergency operations centers to direct and coordinate resources and response activities for COVID-19 declarations, communications to disseminate public information regarding health and safety measures and provide warnings about risks and hazards, mass casualty management, including storage of human remains and mass mortuary services as necessary to manage fatalities caused by COVID-19, purchase and distribution of personal protective equipment that is directly related to the performance of otherwise eligible emergency work or is provided to healthcare workers, patients with confirmed or suspected COVID-19 infection, and first responders. There's a couple notes here on stockpiling and storing PPE. As stated in FEMA's new policy, funding for the stockpiling of eligible personal protective equipment is limited to a supply that is projected for use for up to 60 days. Under the policy, applicants can obtain PPE for active use for purposes consistent with the policy. Orders should be placed based on estimated burn rates and for reasonable time frames to ensure availability of PPE. In addition, applicants can obtain and stockpile additional PPE to have available in case demand increases. This amount should be limited to a 60-day supply based on a reasonable expectation of burn rates at the time of purchase. All PPE, whether purchased for active use or as a stockpile in reserve, will be subject to disposition requirements at the end of the period of performance. Ineligible costs. The following costs are not eligible for reimbursement through FEMA's public assistance program, and that includes increased operating costs, including costs associated with remote working, education, and healthcare, loss of revenue, income, or donations, costs associated with contact tracing, costs of employees quarantined or out sick, the costs of reopening facilities that closed due to the pandemic or scheduled closures such as schools. For all projects, FEMA will closely review applicants' documentation of specific public health guidance the applicant followed in incurring the cost, as well as applicants' decision-making processes in evaluating courses of action and associated costs. Now, costs must be reasonable. They must be reasonable and necessary to accomplish the work, compliant with federal, state, and local procurement requirements, reduced by any applicable credits such as insurance and other funding sources, and the claim cost must be necessary in order to respond to the COVID-19 pandemic and be reasonable pursuant to federal regulations and federal cost principles. So pursuant to federal regulations, the emergency work completion deadline is 6 months from the disaster declaration date, and that would be September 20th. However, the unprecedented incident period and impacts of the COVID-19 pandemic necessitate that emergency protective measures continue beyond the typical deadline. Therefore, FEMA has extended the emergency work completion deadline until further notice. FEMA will make notifications prior to the establishment of a deadline for completion of emergency work. And again, we will post this presentation, both the slide deck and the recording, on our website, the Dishes Recovery website, under Active Declarations for COVID-19. And I'll leave that slide up for now. So right now, what we're going to do is we're going to pivot to a Q&A. We have a series of questions that we're going to ask FEMA directly. And Molly Avancho, Daniel, Jessica, and Trevor, I believe, will all be answering, primarily Molly. And then we will open up the chat feature for questions. And for those of you that have already submitted, we'll do our best to get those as well. So, oops. Okay, so we're ready for questions.
Okay. So we've been monitoring the questions, and so here's what we have so far. Question number 1, FEMA headquarters recently issued the interim policy for work eligible in COVID-19 declarations. Can you speak to why FEMA determined that it was necessary to issue the interim policy?
So, hello, my name is Molly Avancho. As Andrew said, I work with Region 2. I do not work for FEMA headquarters. Why FEMA headquarters does anything. So I can tell you that with the number of different federal agencies involved in the response, there are a variety of funding streams available to our state and local territories and tribes for the COVID-19 response. So it became very apparent after time passed what funding was available from what agency. So FEMA had to take a closer look at what was appropriate for us to fund based on the Stafford Act, and to ensure that all 10 regions were being consistent in the decision-making process with respect to providing funding.
Okay, thank you. Another question from Scott from the chat. PPE and disinfecting costs incurred from March 17th through September 14th, 2020. Would that be allowable for a school district if captured?
There are a number of different factors that go into making a decision for a request for funding for something like that from a school district. One has to do with whether or not the school district remained open. If the school district remained open and, then we're going to be looking at the cost claimed during that time period differently than if it was closed and no one was using those facilities. So assuming the facilities were open on at some level and being used, we would be looking at disinfection and PPE or face coverings slightly differently based on policy. So for disinfection, if there was a need to protect public health and safety, so depending on who was provided access to the facility during that time, and also based on public health guidance available at the time, if there were disinfection activities that took place during that time, we would certainly consider reimbursing costs. It's hard to answer hypothetical questions without having all of the details. So we would, like I said, look at the need, the public health threat, the public health guidance. If there was nothing specific, if there was no local public health guidance or state public health guidance, we would look to CDC guidance to see that the activities taken were reasonable and supported, and we would have to make a decision. Now, with respect to PPE and face coverings, that's a little bit more challenging for me to answer. Based on guidance that we have written today, the regions, all 10 regions have been and face coverings slightly differently, and it has been a challenge. So in region 2, we look to, again, the activities that are being performed in the facility, who has access to the facility, what type of public health threat exists, and whether purchases were reasonable and necessary. We look at public health guidance to make a determination. Because of the inconsistent interpretation nationwide by all different regions, headquarters found it necessary to get involved to ensure that we're all being consistent. And there will be some guidance provided by headquarters coming out. I wish I could say exactly when, but soon. That guidance, we've been told that guidance will be providing clarification for both disinfection activities and PPE and face coverings for the time period that you're referencing in that question. So a little difficult for me to answer right now. If we had to make a decision, that we would go off of what we have in writing now. We'd go off of our PA program and policy guidance and the Stafford Act and our regulations and the fact sheet. However, if we make a decision today regarding PPE or face covering and infection, and this new guidance comes out from headquarters tomorrow, our decisions next week could be different. I just know that this guidance is coming out. I don't know what it's going to say. The other thing I wanted to say with respect to one thing that is very clear that headquarters has informed us has to do with reopening, and it impacts every facility, not just schools. Essentially, if we have to look at work required to respond to the COVID-19 health emergency. So if at any point a facility closed during that time period between March and September 15th, they closed down. They no longer, the public had no access to this facility. At that point, the threat was eliminated. There's no one entering that facility. So then at some point, the facility may, or the agency that operates that facility may have made a decision to reopen that facility. And essentially by opening that facility, the agency or entity is now taking on the responsibility to operate its facility safely. And so costs associated with PPE, disinfection, very well could be looked at more as an operating expense for that particular facility. So we do have to ask questions about whether a facility remained open or closed, and the timing of that, and who had access to the facility, and decisions that were made throughout that time period. So again, there's a number of factors that we have to look at before determining whether we can approve funding. Long answer to that question, but there was a lot to it.
Well, thank you for that, Molly. Another question came in, and I think you touched base on some of this, but the question is in regarding to pre-September 15th, 2020. Is all PPE provided to public employees, to first responders, and at public facilities eligible as long as it's supported by public health guidance? Given the March 19th EPM fact sheet that lists PPE as eligible work without caveat, will you be going under that fact sheet for determination?
So that's what I was referring to when I said that regions were looking at those and that work differently, and where FEMA headquarters has determined there's a need for clarification. Today, FEMA Region 2's interpretation is that fact sheet and our PA program and policy guide allow for some distribution of PPE or face coverings that if health guidance, if there are, certainly cases in the area, that sort of thing. However, I just want to caution you, this clarification, we're waiting for the clarification from headquarters. I don't know which way they're going to land on this. As soon as, if the clarification provides the regions with direction that is different than the way Region 2 has been operating, then Region 2 has to course correct. And we're going to have to go off of whatever guidance is provided.
Okay, thank you for that, Molly. Another question that's come through. In the interim policy states that it applies to work performed on or after September 15th, 2020. Prior to this date, policies in place when the work was completed apply. What is the definition of work performed and work completed in the context of the interim policy? Do they mean the same thing? And if not, what is the difference?
So it really, again, depends on what work and costs are being requested. In terms of disinfection, it's a lot clearer. The work would be disinfecting the facility. So the work performed would be disinfecting the facility, and the work would be completed when the disinfection is completed. So if we're looking at disinfection before and after September 15th, if before September 15th it was an eligible activity, we would be able to simply say reimburse for a mass quantity. We would have to ask, what did you time period? When did you complete these disinfection activities? What were your costs associated with activities, including labor and materials and supplies? We would also ask, what did you do before COVID-19? And we would look at any costs or work above and beyond your normal disinfection procedures. So it's a little easier in the context of disinfection. With respect to PPE and face masks, we have to look at it again under the context of the request. So if, for example, we're talking about a medical care facility, and they're asking us to reimburse for costs for PPE necessary to provide health care. The cost of the PPE is provision of health care. So the work itself is the healthcare, and the costs associated with the PPE are costs associated with the work. So we would look at the timing of the provision of the healthcare. If PPE and or face coverings were purchased for distribution, then and not purchased in order to conduct work, then the work itself would be the distribution of the PPE. So we would have to look at, again, for each agency and entity, why did you buy it? Who did you give it to? When did you distribute it? And certainly any purchase or distribution completed after September 15th would not be eligible unless it met the criteria in the policy. Before September 15th, like I said, Region 2 feels, based on current guidance, we still have room there to reimburse costs. But we are aware of this clarification that headquarters is putting out soon, and our position may have to change.
Thank you for that, Molly. Another question that came in through the portal. For behavioral health clinics to continue to see patients in reference to mental health and substance abuse in a safe and secure way, technology was required to service patients in a virtual world. Are these technologies covered according to FEMA?
No, that has been a pretty consistent, I guess we've been consistent in our response there. Headquarters was very clear in the beginning that any virtual, purchase of laptops or Wi-Fi or equipment to operate remotely is considered more of an increased operating cost for that entity and not an emergency protective measure necessary to respond to the COVID-19 health emergency.
Thank you for that, Molly. Another question from the portal. We are a school. How long do I have to submit our application from January 20th, 2020 to September 15th of 2020 in order to secure reimbursement for PPE services?
Currently, that's a tough question right now, because currently the guidance that we have ties that that requirement, the timing for submitting your project, it ties it to the public health emergency, which I should know this ends October or something, 24th-ish. However, I anticipate that we may be getting new guidance with respect to the deadline for submitting projects. Our policies used to be tied to the public health emergency, but that has changed. So I'm thinking headquarters might change the deadline to submit projects as well. But as of today, it's tied to the end of the public health emergency. So, certainly look for new guidance. I would encourage you to submit what you have right away.
Another question from the portal. It sounds like schools will no longer be able to request reimbursement for our PPE needs and disinfecting materials and our contracts associated with disinfection of our schools after September 15th, 2020. Is that correct?
Yes, absolutely. And there will already restrictions in place for any PPE or disinfection activities that occurred prior to September 15th. Like I said, it all depends on how your schools were operating and whether there were, public access to the facilities. So, yes.
Thank you, Molly. Another one from the portal. Are nursing homes and assisted living programs considered a medical setting under these new rules that go into place September 15th, 2020?
I'm going to policy so I can read it word for word, but basically the key is whether the facility provides medical care. The policy, the healthcare policy, give me one. Basically, we look at whether the facility provides medical care. So there tends to be a distinct difference between nursing homes and assisted living. Nursing homes tend to fall under the category of a facility that provides health or medical care. And I don't want to delay this, but yeah, basically that's how that question would be answered. And opening it right now, medical care. Okay, so for medical care provided in a primary medical care facility, that's what we're talking about. And then at the end of our policy, we define what a primary medical care facility is. And a primary medical care, it says medical care refers both to assistance provided to support the provision of medical care and assistance for clinical care. Clinical care refers to medical treatment of individual patients, including testing, diagnosis, treatment, hospitalization, prescriptions, and other costs. Primary medical care facility is the facility owned and or operated by an eligible PA applicant that provides medical care services. So that's the key, medical care services. This includes any licensed hospital, outpatient facility, rehabilitation facility, or facility for long-term care. Nursing home, as long as it does provide medical care services, generally falls under that umbrella. Assisted living type facilities generally don't fall under the umbrella.
Okay, thank you for that.
Mm-hmm.
Another question that came in. Does work completed in regards to the purchase of PPE and disinfection mean the order date, the receive date, or the paid invoice date?
None of the above. It's not about when something was purchased. It's about when the work was completed. So again, with regard to disinfection, it's when the actual disinfection of the facility took place. And again, with PPE or face masks, it depends on whether the claim is for PPE and or masks being used during the conduct of some other eligible emergency work. In that case, it would have to do with when that emergency work was performed. If it's related to the actual distribution, and has nothing to do with eligible emergency protective measures, then we would have to look at when the PPE distributed. And that's, that area when we're talking about purchase and distribution of PPE and face coverings, that is the specific area where we're awaiting clarification from headquarters on what would be eligible versus what's not eligible. That's where that's the key aspect of the policy that has been interpreted differently throughout the 10 regions. And so, once that clarification comes out, again, I might be giving a different answer.
Okay. And a follow-up to that by one of our applicants is, when determining whether an expense can be included, given work completed, we have found challenges with the items being back ordered for a long time. How can we get reimbursement if it's a supply chain issue?
Unfortunately, if you order something and it's not used, then, we look at the work that an applicant is doing. And first, that work has to be eligible, and then the costs associated with completing that eligible. So if if you, for instance, ordered a large mass quantity of disinfectant and didn't receive it, then I don't know how you could possibly be actually disinfecting your facility unless you're using, material from your stock or your own inventory. So we have to look at what you used in completing the work during the time frame that we're looking at. So if there's back orders, that may be a situation where you won't be able to be reimbursed. We look at the work and when the work was performed and the costs associated with completing that work.
Thank you, Molly. And another one in that sort of chain of thought. The interim guidance states that only a 60-day stockpile will be reimbursable. How will that be calculated? If an applicant's burn rate changes and unused PPE remains, will there be no reimbursement for the unintended stockpile post 60 days?
So personally, I think the stockpiling language in the policy has, I think it's created more confusion than necessary. I think really my belief is that the issue with stockpiling has to do more with the need to store your stockpile. FEMA was receiving a lot of requests for reimbursement of storage for mass quantities of PPE, face coverings, et cetera. So, FEMA had to make a decision as to how we would determine eligibility for that. Really, regardless of your stockpile, whatever you do, even if you show us a burn rate and you justify the need to purchase 60 days worth of something, and it's all supported by a burn rate, and you go out and purchase it and you ask us for reimbursement and we include those full costs, total costs on a project worksheet for you. And then you never use those supplies, or you only use a portion of those supplies. When the incident period ends and when FEMA establishes a deadline for project completion of all of the eligible emergency work, we would have to go back to you and say, okay, did you use everything? And you would say, no, actually, we stockpiled 60 days worth, but we never used it. Then we would have to look at the fair market value of those supplies and potentially deobligate some funding from your project to meet our regulatory requirements for disposition of supplies and materials.
Thank you for that. We have another question from the portal. We understand the medical care policy remains in effect for this declaration after September 15th, 2020. Do you anticipate any future changes to the community-based testing site eligibility? For example, do you anticipate future limitations related to testing the general public at these facilities?
If anything has shown me that you can't really anticipate anything with these declarations. It's this new policy that came out, so I can't anticipate. I would if I was the one. I mean, the way I speak to FEMA and eligibility, I always say, especially in this situation, you have to do what you have to do for your community and be responsible, watch your decision making with respect to costs that you're incurring. Because yes, one day FEMA may say that we can no longer cover testing at community-based testing sites. That could happen. I couldn't say that I anticipate it. I just know that it's it's certainly a possibility. And one day it will happen. At one point, FEMA will close the incident period and will establish a project completion deadline. So that's, I guess, my best attempt at an answer to that one.
Thank you, Molly. So along with the testing strand, there's another one. We were required to test all employees initially twice a week, and now we test once a week with no end in sight. Are these type of costs eligible for reimbursement?
So after September 15th, the costs for testing are only eligible if the testing is being conducted at a medical care facility, to include a community-based testing site. So testing of employees would no longer be an eligible expense. Prior to September 15th, we have to look at each scenario. We have to look at the facility. We have to take a look at public health guidance. We have to look at the actual threat, and we have to make a determination as to whether or not the work conducted was in fact necessary to eliminate a public health threat. So in some situations, depending on the facility, we may fund testing of employees. It's going to be very limited, though. Depends on the.
Thank you for that, Molly. Going back to the chain of thought regarding eligibility, we have one from law enforcement. Just to clarify that PPE and disinfection purchasing and performed beginning September 15th of 2020 in our law enforcement center, inclusive of the Sheriff's Department and jail, will no longer be reimbursable through DR-4480.
Yes, PPE will still be for first responders. But other than that, yes, you're correct.
Thank you for that. Are cloth and other non-medical grade face coverings eligible for reimbursement in medical settings and in non-medical care settings?
This is one of those questions that we're waiting for clarification from FEMA headquarters. Right now, if Region 2 is presented with a request for a project to reimburse those types of costs, we have to look at the activities that are being performed in the facility, what the PPE and or we're talking about non-medical face coverings or non-medical grade PPE, I think. We have to look at the public guidance. We have to look at the need for eliminating a public health threat. We have to look at the reasonableness of the request, and whether or not the purchase of those items were required to protect life, health, safety. So we would just evaluate the situation presented for something like that today based on what we have in writing today. Once, I know I'm repeating myself, the clarification that will be coming out will, as it's being called a clarification, hopefully it will make things more clear as to what we can fund and what we can't. But today we're operating on what we have available to us to make our decisions.
Okay, thank you for that, Molly. Going to physical barriers. For work performed or completed prior to September 15th, 2020, how is FEMA going to determine eligibility of costs associated with the erecting of physical barriers and signage to implement social distancing? And is there going to be a different approach for such costs incurred after September 15th of 2020?
So we can, and we've always been able to fund communication. And I'm looking to make sure, communications of a general health and safety information to the public. That's what we have to go on when making our eligibility determinations. With respect to signage about social distancing, we're going to have to look at them and make as to whether not, you know, our opinion is that that would fall under communications of general health and safety information to the public. Again, a very hard question to answer. Hypothetically, we'd have to look at the situation. I know we have, in certain situations, already declined to fund those types of costs. So physical barriers, again, if we're talking about installing physical barriers inside a facility, we haven't been funding that type of thing. We have, if necessary, in a healthcare setting or a shelter, but for the most part, you know, I don't want to say never. There was a situation could present itself where we would be able to make a case for eligibility, but I'm not aware of anything to date.
Okay, thank you for that. How does this new interim policy affect applications that were completed prior to September 15th, 2020? Will they need to be redone? Will they be amended, or will they be processed as is?
Well, again, it depends on what the request is. So if it's for work completed before, if the application is for work completed before September 15th, then we're good. If it's for work completed before and after September 15th, then we back to the applicant and request more information so that we're very clear about what costs are associated with work completed before September 15th and work completed after September 15th.
Thank you for that, Molly. On a different note, in regards to emergency child care centers, the question from the portal is, would an emergency child care center that would cover remote schooling for staff with school-aged children, such as medical assistants who otherwise would have to stay home, be fundable due to the fact that they are remote learning?
No, we look at emergency protective measures, right? Measures required to protect life, health, and safety due to the health emergency. So while there are a number of activities that are being performed that wouldn't have to be taking place if there was no pandemic, those activities aren't necessarily eligible under FEMA's public assistance program as an emergency protective measure. I know there are other funding sources out there, though. I'm just not very well versed on all the different funding sources.
Okay, thank you for that. Based on the interim guidance, post-September 15, 2020, is all PPE provided to first responders eligible, or is there some burden of proof to demonstrate first responders are potentially COVID-19 exposed? The policy is silent.
Yeah, that is silent. I see no restriction. At some point, the supply that you purchased, another restriction provided in I see no restriction there.
Okay, thank you for that. This is a common theme one, so I'm summarizing multiple folks in the portal. So if you all don't hear your exact wording, it's because it is a conglomeration of multiple questions. But in essence, folks are hearing, submit your reimbursement request right away. However, the portal is saying pending FEMA RPA review and pending OCC review since June. They're not able to move ahead. When can we expect the release of our projects?
We did get quite a few applications, MPs. we're backed up. I don't know when that will be. I'll ask Dick. Our PA is approved. We're still going to at work needed. So our PA is not approved until next year, until the incident period is closed. We will still look at the work completed during the incident period or in response to emergency during that incident period. We will look at project completion deadlines that are set, and we will look at policy that's in place, work completed at the. So, you know, you don't really have, still going to have an opportunity to receive funding regardless.
Yeah, Molly, this is Trevor. Yeah, I would reiterate, yeah.
Okay, thanks.
Go ahead, Trevor.
Good morning. Sorry about that. Yeah, I would agree, Molly. We are currently processing a large amount of PMPs, which require a substantial amount of review prior to being approved. We are currently prioritizing those based on feedback from the state. So we are working through that process, and we are trying to prioritize RPAs as they're coming in.
Okay, thank you for that, Trevor. Thank you, Molly. So the next question is regarding to universities. What about testing costs for students before entering campus, both students who require quarantine and those who are just returning to campus after quarantine?
At medically necessary testing at a medical care facility or community-based testing site, we can look at funding those. But, you know, university, I know my son went to school this fall, and he had to have his a COVID-19 test. And, you know, really, it's the university taking on the responsibility to operate its university safely. There's a large question. Responsibility testing. So that is not something we would be able to under the FEMA public assistance.
So to follow up on that thread, to qualify for testing cost reimbursement, the testing must be conducted on the site. We are a nonprofit long-term care facility, and due to the mandated test of all staff weekly, the date window retrospective to the beginning of the mandate. So I think what they're trying to ask is, they're doing testing on their work site. Is that reimbursable prior to September 15th, 2020?
It could be. Again, very difficult for me to answer without knowing all the different factors. So all I can say is definitely, you know, speak with your state representative, speak with your FEMA contacts, and provide all the details so that we can look and see whether for that would be eligible. Certainly after September 15th, certain scenarios we have found testing outside of a medical care facility to be eligible, but they are very limited. Nursing homes, you know, in some scenarios would be one situation where we have approved some funding.
Thank you for that, Molly. Going back to physical barriers, there's a question in the portal regarding, will retrofitting our facility space for social distancing be covered for materials and labor, i.e. the installation of plexiglass as well as other physical barriers for the safety of our clients? And I believe this is in reference to post-September 15th, 2020.
Yeah, post-September, well, either they're basically the same. The answer would be the same September 15th and post September 15th, if necessary, in a facility that's providing healthcare, food distribution, sheltering, then the answer could be yes, depending on whether it's reasonable, et cetera. But otherwise, no.
Thank you, Molly. So something regarding payroll documentation. One of the applicants in the portal is asking, regarding the payroll documentation for the forced labor worksheet, if 50 police had overtime for COVID-related activities, do you need the payroll report for the entire 600 FTE department or the individual employee payroll records for that pay period of those that had the overtime?
So we would need the payroll information for the individuals that where you're claiming the overtime. Trevor, right? I mean, there's nothing, we wouldn't ask for the payroll for the entire department. If they're asking for overtime for the employees, we would want the payroll information for the employees.
Correct, and we're also looking at different options for certification of the backup to support the overtime for those specific individuals. At a minimum, we'll need a summary sheet identifying the hours worked.
Okay, thank you for that clarification. We have about 3 minutes left. I think we can squeeze in one more question. So question from the portal. Do federal deposition requirements apply to small projects? If so, what documentation are applicants required to maintain or produce to establish compliance? Is FEMA anticipating making amendments to small projects based on residual supplies? Are applications expected to request such amendments?
Yeah, that's going to be a real quick answer. I don't know. I don't know the answer to that yet. It's on the list to find out. Disposition requirements certainly apply in general. Because we have simplified procedures in play for small projects, I am not sure, but I am going to find out.
Thank you, Molly.
Mm-hmm. So this is Ann Bank again. Since we're nearing the end of the hour, I wanted to thank FEMA Region 2, Molly and Trevor in particular, for answering questions from our applicants. Clearly, we weren't able to capture all of the questions that were asked today. So we will review those and work with the region to get responses to the outstanding questions, or if there are clarifying questions based upon the region's responses, we will work with you to capture those as well. And as you heard from the region, clearly this event continues to be dynamic, and there will likely be additional guidance forthcoming from FEMA headquarters. We will keep you in the loop and keep you apprised on all developments related to any policy adjustments or changes as they occur. So we thank you again for your time today, FEMA Region 2. We thank all of our applicants for all of their hard work over the past 6 months and everything they're doing to keep the state safe. So with that, we'll sign off for the day and we'll be in touch shortly. Thank you very much.
Thank you, everyone.
Thank you.
Thank you.